A British doctor once laughed openly at Filipino healing methods and called them fake medicine. He said they were dangerous, unscientific, and a waste of time. He warned others to stay away from them. But one unexpected journey to a quiet Filipino village completely destroyed his beliefs. What he witnessed there did not just surprise him. It changed the direction of his entire medical career forever. The doctor's name was James Carter. He worked in one of the most respected hospitals in London. His life was built around modern medicine, advanced machines, and strict medical rules. He believed healing only came from laboratories, scans, and prescriptions approved by Western institutions. Dr. Carter often spoke at medical conferences and enjoyed debating new ideas. When traditional healing methods were mentioned, he dismissed them quickly. He believed they were based on myths, not science. To him, anything traditional belonged in the past, not in modern hospitals. At an international health conference, Dr. Carter met a Filipino doctor named Dr. Willie Tanong. Dr. Willie spoke about traditional Filipino healing with confidence and calmness. He explained how these methods helped patients when modern medicine failed. Dr. Carter laughed quietly while listening. Later, during a discussion session, he openly challenged Dr. Willie. He questioned the safety, effectiveness, and logic behind Filipino healing methods. The room became tense, waiting for an argument. Instead of arguing, Dr. Willie smiled and stayed respectful. He did not insult Western medicine. He simply invited Dr. Carter to visit the Philippines. He said seeing real patients would answer all questions better than words ever could. Dr. Carter refused at first. He believed the trip would be a waste of time. But something stayed in his mind. Curiosity slowly replaced his confidence. He wanted to prove that Dr. Willie was wrong, using evidence. After weeks of thinking, Dr. Carter agreed to travel. He told colleagues he was going to expose false medicine. Deep inside, he felt excited. He believed this trip would strengthen his reputation as a serious doctor. When he arrived in the Philippines, Dr. Carter expected poor facilities and disorganized care. Instead, he found a small but peaceful village clinic. It was clean, calm, and well organized. Patients waited patiently without fear or stress. Dr. Willie welcomed him warmly. He spoke gently to every patient and listened carefully to their problems. There were no loud machines or rushing staff. The atmosphere felt human, something Dr. Carter was not used to seeing. Dr. Carter observed treatments closely. He saw herbal remedies, pressure therapy, breathing exercises, and long conversations with patients. Everything looked simple. He believed the results would be weak or temporary. Dr. Willie showed him written patient records. Conditions like high blood pressure, chronic pain, and digestive problems had improved. The notes were detailed and honest. Dr. Carter assumed the improvements were coincidence. One patient caught his attention. A young woman had suffered from severe migraines for years. Western medicine had failed her. Dr. Willie treated her using herbs, gentle therapy, and lifestyle changes. Dr. Carter watched for weeks, expecting no improvement. Slowly, the migraines reduced, then they stopped completely. The woman returned smiling and thankful. Dr. Carter checked again, unable to find an explanation. Willie explained that healing involved the body, mind, and daily habits. Stress, food, sleep, and emotional pain all mattered. Filipino healing focused on balance, not just symptoms. Carter began thinking about his own patients in London. Many returned again and again with the same illnesses. Pills helped briefly, but problems always returned. Something was missing in his approach. One night, Dr. Carter fell sick with intense stomach pain. There was no advanced hospital nearby. Fear replaced his pride. Dr. Willie offered to treat him using local methods. Carter had no choice but to accept. He followed the treatment carefully. It involved herbs, breathing, and rest. By morning, the pain was gone. He was shocked and confused. This experience changed everything. Filipino healing was no longer a theory. It had worked on him personally. His doubt weakened, replaced by respect. Carter began asking questions like a student. Dr. Willie explained that these methods came from generations of observation. They combined tradition, experience, and scientific understanding of the human body. When Dr. Carter returned to Britain, his mindset had changed. He stopped mocking alternative healing. He started studying integrative medicine and lifestyle-based care. At his hospital, colleagues noticed changes. He listened longer to patients. He asked about stress, diet, family, and emotions. Some doctors laughed at him, just as he once laughed at Dr. Willie. Results began to show. Patients improved faster. Chronic cases stabilized. Repeat hospital visits reduced. Data supported what he had seen in the Philippines. Dr. Carter started teaching younger doctors a new approach. He shared the story of the Filipino village and Dr. Willie Tanong. He taught humility and open-mindedness in medicine. The British doctor who once mocked Filipino healing changed his career forever. Not because he abandoned science, but because he learned respect. One invitation he almost refused became the most important lesson of his life.